Good evening, students. I'm Dr. Rohit Singh, Professor of Pharmacology. Now, students, today I'm here online to discuss about the community pharmacy and what are the responsibilities of a community pharmacist. Community pharmacist, if you really see, community pharmacist will play a wide role of aspects in the society of medical field where they have unique aspects in their roles and responsibilities. So let's try to have an overall view of the exact roles and responsibilities of a community pharmacist. Now, before that, students, let's try to see what is community pharmacy. Now, there are many definitions which are given as an outlook to a community pharmacy. But really, if you see a community pharmacy, anything which is in retail aspects of a pharmacy or any healthcare facility which provides a wide range of pharmaceutical services to a specific group of community in treating the disease of a patient is referred to community pharmacy. Now, very well, it is not only about the dispensing of medicines or drugs. Again, it also deals about the storage conditions of the drugs. It also deals about the dispensing proper medication of the drugs. And at the same time, it also deals with the supplied or the sold drug in a group of community. Now, very well, community pharmacy as an overall aspect, it itself is a branch of pharmacy which absolutely deals with patient care. Now, here you have to know, student, you as a community pharmacist, you yourself are directly and indirectly involved in the patient care by dispensing an appropriate medication to the patient. Now, once you dispense the medication, whatever is being written by a registered medical practitioner, now your responsibility doesn't get stopped at the court of only dispensing. Now, beyond dispensing, it is somewhere you also try to advise the patient, you try to educate, and you also try to give a brief instruction to the patient about the rationally use of drug. Now, in the society, in the field of community healthcare, if you really see, the wide diverse of pharmaceutical preparations are spread. Now, it is your responsibility as a community pharmacist to educate the patient in proper usage of these drugs very, very commonly. So that is all is about the community pharmacy. Now, let's try to talk about the services of pharmacist at community level. Now, this community pharmacy has a very good scope in upcoming years, even in India. Now, if you see the services of a pharmacist, now what are you really going to do? There was an era or there were a time where, the precautions were like the pharmacist is only restricted to give a proper drug, so and so drug to the patient. Now, beyond that, if you see, you as a pharmacist at community level are involved in patient care services, where at the same time, apart from dispensing the right drug with the right dose to the patient, you are also involved in counseling your patient who comes with a prescription. You are also involved in giving an appropriate direction to a patient in proper dispensing method of a medication. You also try to discuss with the patient about the medication therapy with what suitable dosage form and instructions the patient has to take. For example, students, if you get a patient who has a prescription carrying with antidepressants, or who has a prescription carrying with anti-anxiety drug, where you try to discuss, you try to talk to a patient and you educate the patient on what for the prescription is being given and at what regularly interval the patient is about to take the prescription, and if any adverse effects are related to that particular medication, then you try to educate the patient whether they are expected adverse effects or they are unexpected adverse effects. So these are the services of a pharmacist, what you're going to give to a patient, both in terms of patient care services and beyond that, in also educating your patient. Now, when these services are given to the patient, now you have to broadly know what are the types of community pharmacists. Now, usually the classification falls into broader two category. One is the independent pharmacy. The other category is a chain pharmacies. Now, if you really see a comparison model between an independent pharmacy and a chain pharmacy, usually in independent pharmacy, they usually vary in size. They also have a limited handling of prescription. And very, very commonly, if you see independent pharmacies, the individuals are confined to their own stores, where usually a single person will be heading the pharmacy, or sometimes more than one person as an more than group can head the pharmacy, that is at independent level. Now, community very commonly again aims for chain pharmacies. Now, what is this chain pharmacy? Now, here it is something like the retail pharmacies, which are really owned by a group of corporate sector, which consist of stores of a pharmacy, either in a specific region or into the entire nation. No doubt, chain pharmacy in comparison to independent pharmacy, they usually vary in size. The volume of prescriptions, what they handle is always bulk in comparison to independent pharmacies, and very well, more number of services are provided by chain pharmacies. So this is how broadly we try to classify the community pharmacies. Now, let's try to go a little bit into the detail by knowing what are the services offered by community pharmacy. Four major types of services have been offered. The one is essential service, advanced services. Now, very commonly, the services offered by community pharmacists at community level also have a deeper relationship of a community services to both nursing homes or the corporate or the specialty clinics, followed by some other services. Now, let's try to see in detail about the essential services. Now, you as a community pharmacist at community level, what are all the essential service we try to document? One is the dispensing of medication. The second one is repeat dispensing. Then comes the disposal of unwanted drugs, then referring to physician, followed by the support of self-care. Then comes the clinical governance. Now, let's see the dispensing as an essential service. Now, students, again at community level, it is not only dispensing the medication. You, as a pharmacist, you also try to advise the patient, apart from dispensing, on regular usage of that medication. How to use, when to use, is it once daily, is it twice daily, is it thrice daily, it should be taken before food, it should be taken after food. So these are all the criteria what you are going to follow under essential service when you try to dispense that particular medication, where at the same time you're going to follow the maintenance of records. When you dispense a prescription, The prescription has to be documented. Then comes to repeat dispensing. Now, for a second visit, when usually patient return back to pharmacy, you as a pharmacist, you have to consider, you have to see the condition of a patient. If patient prevails into some abnormal condition or some ill health associated condition, upon repeated usage of same medication, you have to conform to the ill behavior of a patient. Then with the same prescription, you have to repeat the dispensing. Maybe patient may not go to a doctor, patient may not refill his or her own prescription, but if patient return backs with same prescription, you're supposed to follow the opinion of the patient, whether really he or she is sick or not. Then you try to repeat the dispensing only if you feel it is quite essential. Then comes the disposal of unwanted drugs. Now, it is very much understood that it's a logical point. Any pharmacist usually have to dispose unwanted drugs from the drugstore. Let it be a retail pharmacy, let it be an independent or a chain pharmacy. Any spurious drug or any drug which expired date or any drug which is not much into the selling process have to be discarded or it has to be disposed of. Then comes the criteria referring to other physician. Now remember pharmacist. As a pharmacist, very commonly, only if you find it is necessary, very commonly, you personally try to refer the patient to any of the physician or a care provider, where in your opinion, if you find patient is not normal in taking the prescription, or if you really feel your patient is misusing the prescription when it comes to schedule H group of drugs, when it comes to anti-anxiety, antipsychotics, antidepressant group of drugs, then you personally as a community pharmacist can refer the patient directly to the physician. Then comes the logic of support for self-care. Now, this usually focuses on the self. Now, here you should know as a community pharmacist where you try to enable people to derive maximum benefits for caring themselves or their families. So, this is a very logical behavior where one as a community pharmacist have to really go through the sequence of directing the patient when it really comes to essential services. Then what about clinical governance? Now, clinical governance is something, an outlook and something of a fresh image under the essential services. Now, here, you as a community pharmacist, you have to educate the patient to practice leaflets per patient. If you see any box of the medication or any container of a medication, the leaflets, the full pharmacological profile description of a drug will be given. So try to practice providing that leaflet or drug information to the patient, where you have to follow certain standard operating procedure. In case if your patient develops any side effect or any adverse effect, then patient safety is your first priority, where you have to educate your patient to report the incidence of those effects to national reporting centers very, very commonly. And you should always be aware of drug alerts. Some drugs are banned in the market. Some drugs cause more tendency of adverse effects, or certain drugs should not be sold as over-the-counter drug as per the different schedules of the drug given. So you as a community pharmacist should be very well aware of this clinical governance so that you don't directly sell or directly give a drug to patient. No doubt the cleanliness and the infectious control measures in the particular place wherever you are working in dispensing of a medication should be maintained appropriately, and you should always have very common the whistle blowing policy to create awareness among the drugs or to create awareness among the adverse drug reactions of that particular drug. And very well, you have to remember, students, conducting regular clinical audits and patient satisfaction survey is an important parameter and concept of clinical governance. Now, very commonly, if you see in abroad, in the Western culture, where clinical pharmacist is the whole and foremost priority given for the regular monitoring of the prescription. So their regular clinical audits are being conducted. In India, still it will take years to practice this, but yes, this also parts a basic emphasis of clinical governance. Now let's try to discuss about the advanced services. Now, under advanced services, if you see, it is something you should know about the medicines use review and the prescription intervention services. You should also have a sound knowledge on the new drugs or medicines services. And at the same time, you should also have the concept of appliance use review services. Now, as a part of clinical pharmacist into the community scenario, what do you really understand by the medicines use review and prescription intervention services? Now, here, you as a responsible pharmacist, you conduct the reviews related to drugs with patient. You try to review the product of that particular generic name where your review will evaluate the use of drug to a patient, where it really tries to help the patient and also to the pharmacist and also to the third party to identify and express and address the problems experienced by a patient. For example, if I'm taking paracetamol, if I come to you with a prescription of paracetamol, then you try to put a review on paracetamol by knowing its side effects, by knowing its dosing frequency, by knowing its cost effective price or pharmacoeconomics. So that is how you are going to have an intervention on the prescription services. Now, secondly, coming to the new medicine services. Now, most of the times, if you see, hundreds of drugs, they do enter into the market almost all every day. Many new formulations come into the market every day. Now, in order to improve very commonly, what do you say? The patient's understanding of newly prescribed drugs for longer time of duration, you as a pharmacist have to safeguard the health of a patient and you have to provide information to the patient. Patients with hormonal imbalance or patients with cancer who are kept on chemotherapy for longer duration, or patients with chronic kidney disease who are kept on longer duration of treatment, where monoclonal antibodies, where newer group of antibodies are coming every day into the market, where patient is not aware. You are also not aware. After the review compass, then you are going to provide a detailed information to the patient. So that is with the concept of new medicine services. Then comes the concept of appliance use review services. Now, this service, if you see, students, it literally tries to help the patient to understand and use the prescribed medical appliance. For example, the stoma appliance. If you see the stoma appliance, a specific category of appliance, how patient has to use it, how patient has to review it, and what safety parameter you as a clinical pharmacist are going to advise to the patient with the appropriate storage of appliance, Then later on, after using it, then how the patient is supposed to dispose of the suitable appliance, that has to be communicated when it comes to the services of appliance use very commonly. So, what I'm trying to tell you is, as a pharmacist, you're not only restrained or constrained from the drug usage standards to the patient, beyond that, the regular appliances of certain therapeutic approach should always be kept in the mind for proper review. Now, coming to the other services offered, if you see, the community pharmacy relationship and the service to nursing homes and clinics. Now, do you all agree with me? You are not only restricted to retail or a chain pharmacy. Now, the pharmacy itself, when you really see, it is either associated with a corporate hospital, or it is associated in the urban care center, it is associated with a rural health center, or it is also associated near to the smaller sections of nursing home. So you, as a community pharmacist, you have to make it a responsibility of even visiting the nursing home regularly when required and when needed, where you provide different services. What are the services at the nursing home or at the corporate level you can provide? You try to provide the enquiries, or you try to provide the advice related to prescription. Remember, students, pharmacy is not only the fine art of making drugs. The days are gone. Now, pharmacy is deeply involved in scrutinizing, reviewing, and also giving advices to the hospitals by your surrounding. At the same time, you should make sure that you advise the patient, you monitor the patient with appropriate use of drugs specifically for longer duration, for diabetes, for cancer chemotherapy, have to be monitored by a community pharmacist. No doubt, you are also engaged in inspecting the drug records of the patient, whether the patient is fulfilling the required prescription or not. If not, then you have to take a responsibility one step ahead to communicate with the physician directly concerning your observations, what are noted down in relation to the patient. Still, if patient is not satisfied, still if you find patient disoriented somewhere with the use of wide variety of medication, it is also your sole responsibility to counsel the patient and also the supporting staff in order to govern good intake of prescription. So that service, what you are going to provide to the nursing homes and the clinics in relation to you as a community pharmacist. Now, what are the other services? Now, other services broadly falls into the category of compounding services, the home infusion services. It can be related to surgical supply or medical equipment services, as I have already discussed. Definitely patient education services, miscellaneous services. Now, remember, students, when it comes to miscellaneous services, substance misuse services should broadly be considered, where narcotics, non-narcotic substances which directly act on central nervous system has to be given due consideration. Sexual health services, patients do oftenly get offended to discuss, or they hesitate. They have an embarrassing feeling to discuss the prescriptions which are related to sexual health. So that services have to be considered. Smoking cessation services, alcohol misuse services. So all these broader services, they all play a major impact on the role of a community pharmacist. Now, when we talk, there are certain other responsibilities of a community pharmacist, which also features the community pharmacist as FIP, which is nothing but International Pharmaceutical Federation, has given an important list of features. Now, what are those features as per FIP? Always remember, a community pharmacist should always be an expert in pharmacotherapy. You should have a sound knowledge of pharmaceutical care and also the health promotion, which is very, very important. As a community pharmacist student, you have to be an effective communicator, a very professional communicator to the patient, to the healthcare provider, where you should be in a position of decision making in relation to the prescription of a drug, in relation to compounding, or in relation to dispensing of medication. Always remember, at community level, you should provide high quality services. You should always have a sound full knowledge or in detail pharmacological evaluation of a particular drug, where not blindly but with very full knowledge you can dispense medication to the patient. Remember, at the same time, FIP also emphasizes more on the documentation of your work, how you document it, how you report, and how you are going to communicate the outcome analysis of your professional behavior and also an outcome to professional colleagues. So these are all the features of a community pharmacist based on International Pharmaceutical Federation, where you should be an expert in pharmacotherapy, knowing in detail about the pharmacokinetics, the pharmacodynamics, indications, therapeutic indications, and adverse drug reaction profile of a suitable and single parent drug, whatever your patient is getting from community pharmacist at community level. Now, coming to the duties and responsibilities of community pharmacists. Now, after seeing an overall outlook of this, I'm very well sure you might have got some basic frame of your own roles and responsibilities at community level. No doubt, the first responsibility of yourself will be processing prescription. When it comes to processing prescription, students, always you have to remember, when you receive a prescription from a patient or when patient receives a prescription from the doctor, you have to start preparing your patient to take that prescription properly. Regular follow-up visits for the prescription are very mandatory for you to process that particular prescription. Then comes the second valid responsibility, checking for drug interaction. That's what we discussed in previous slide. As per FIP, you should have a sound knowledge of pharmacotherapy. So that means you at community level should also be able to trace out drug to drug interaction. Make sure the medications, whatever you're dispensing or whatever doses the patient is being advised to take, the doses, the medications, you have to check with drug to drug interaction. And you at community level with the prescription should also advise the patient to not to have two or three drugs, whatever is being prescribed at a time, or you should also advise the patient not to take any other medication beyond the prescribed level because of harmful drug-drug interaction. Then comes the third responsibility as dispensing medication. Now here, students, you have to remember labeling the medication correctly with the suitable instructions to the patient is quite essential. How patient is supposed to take a medication. See, in country like India, where still ours is a developing country, we still get patients from very low socio-economic status, where patients do not emphasize in labeling or reading the caption of that label. They don't at all read the leaflet. They don't read the directions. They don't read the instructions. So, in that case, you as a responsible pharmacist have to give specific dispensing directions of that medication to the patient. At the same time, your sole duty also lies in promotion of healthy lifestyle. Always support the patient in promoting healthier lifestyle. Always advise the patient to have a nutritious food upon intake of regular medication. If a chronic smoker comes to your desk when you put a dispensing, then advise them to quit smoking. If a chronic alcoholic comes to your desk when you go for dispensing, advise them to quit alcohol. See, this is all bit weird. We usually don't practice in India. No, but if you want to be a very good community pharmacist at community level, beyond the scope of pharmacy, you have to educate. You have to give a friendly advice to your patient as a whole and sole part of your duty and responsibility of a community pharmacist. Please remember, students, you have to also maintain the compatibility of different treatment. Treatment aspects do vary in each and every terms of disease. Patient coming with a prescription to the pharmacy is not diagnosed with one specific disease. Patient is diagnosed with diabetes, with hypothyroidism. Patient is also diagnosed with some angina, myocardial infarction. So the compatibility, the modality of the treatment with different group of drugs when you are giving a poly prescription should also be maintained and checked thoroughly. At the same time, you should also be responsible in communicating with doctors and also other healthcare providers in regard to prescription. Doctors, they are quite busy in prescribing. They get quite busy with different n number of cases. But at times, what do happens is doctors also do not focus on drug to drug interactions. They do not focus on drug food interaction. Sometimes, off the label, the medicines which are banned, they try to focus on those medication. So you as a community pharmacist can have an overall outlook of these prescription. Then you can provide suggestion to a physician or healthcare provider in appropriate use and appropriate selection of drug, where the main criteria lies with selling the over counter medicines. I will give you an example. It was 2 days back when I went to pharmacy to get a tablet of paracetamol. I just saw two students, they just came to pharmacy and they were just asking to give a doxycycline tablet. I'm telling you with my personal experience. When I saw a pharmacist without any prescription just giving a doxycycline tablet to those two students, then I question, doxycycline should never be given without prescription. And for what reason the students are taking and for what reason the pharmacist is given doxycycline was absolutely a question mark. So remember, students, only certain drugs, they fall into the criteria of over the counter selling, but not all the group of drugs, where you should have a sound knowledge, and it is your duty and responsibility to keep a track on OTC drugs at the pharmacy. At the same time, you should have a well equipped knowledge in documenting and in maintaining the records of all the controlled drugs for legal and stock control purposes. You have different schedules of drug, schedule H group of drugs, drugs which come under narcotic analgesics, general anesthetics. Many such group of drugs are there. So you should always have the maintenance of your records. So these are certain roles, duties, and responsibilities of a community pharmacist. Very well, it is also said that you should also have a sound responsibility of preparing an appropriate dosage and cassette boxes, where you might have seen in the stores of a pharmacy, different boxes of drugs are incorporated. Some are for elderly group of population, some are for the patients, very commonly for geriatric or the pediatric group of patients. So very commonly patients who have memory or learning difficulties, so their such dosette and cassette boxes can be incorporated. Evaluating and conducting research programs are also an integral part of community pharmacists, where you can train your own staff. You can also train students at the other grade of level in these roles and responsibilities. Nevertheless, budgeting and financial management is also your core element. Planning the budget or running the retail pharmacy or the chain pharmacy do also plays a very pivotal role, where you at community level also try to keep update information on current pharmacy practice. What are the newer drugs? What are the novel drugs? What are the existing drugs? Whether they are matching with the novel drugs or not, or what are their indications? What are their contraindications? So, all update information has to be kept by a community pharmacist as their duties and responsibilities. Now, coming to the major portion, the skill of community pharmacist. What skills you as a community pharmacist should have? No doubt you have to focus very commonly on the communication skill. How gentle you are, how polite you are, how effectively you are having one-to-one communication with your fellow patient in educating, in teaching, and also in dispensing the medication. Remember, students, always have concern for the welfare of general public. At the same time, you should have a very good coordination when you work in a multiple disciplinary team, when you are posted in a corporate hospital, or when you visit abroad as a community pharmacist. How well you gel with a group of people, how well you go with a multidisciplinary group of team is quite essential. You should always be in a position to take the responsibility of the pharmacy very well. You need to establish the trust with the fellow pharmacist, with the fellow pharmacists who are working into a group of chain of the pharmacy, where you also try to understand the business tactics, the business principle at higher grade of community level. Now, definitely, as a skill of community pharmacist, you have to be quite professional and confident demeanor. Very well, that professionalism, if you show that, if it reflects in your profession, then really you can excel far beyond the community pharmacist. Now, very well, to have overall excel to all these information, students, apart from the normal communicator, you should always update your knowledge and information regarded to drugs. Remember, drugs in general use, drugs which are going to come into the pipeline, you should also have an overall outlook of the in detail network of drug research, the newer methods and principles of practicing these prescriptions by the doctors. What are the different policies the government of a particular nations they inculcate? So overall, you should have an updated knowledge. So all these skills will formulate the best outstanding community pharmacist. Remember, you should also have a very soundful knowledge, a very great sense of knowledge regarding to pharmaceutical care, pharmacotherapy, what we discussed, and also the health promotion policies. You, as a community pharmacist, should always inculcate an habit of maintaining that higher degree of standards in relation to drug products the services, and of course, communication, where again, maintaining the records, maintaining the documents in proper order, whatever is being dispensed, whatever is being getting up from the manufacturer, the entire stock order of record has to be maintained by a community pharmacist. So this is how overall the community pharmacist plays a very pivotal and a very vital role in maintaining overall the health of an individual. Though community pharmacist is still upcoming branch and department in India, but yes, in coming 1 or 2 years, it will be a well-established branch in developing country like India. So this was the overall concept of community pharmacy, roles and responsibilities of community pharmacists. Now, students, if you do like it, try to subscribe it to Prakara, and you can keep on giving your updates on this. Thank you so much.